We'll try to get through this one together. It's been a long and interesting couple of days, and we've just had lunch, and we'll try to keep one another awake through this session. What has been quite interesting to me is this paper was written, obviously, like the other papers were before the conversation that just took place, and in thinking about how to best focus on this so-called fifth paper. I'm, with your permission, I'm going to jump sort of into the middle of it and then work backwards. And the reason I'm doing so is because I think that there's several things that have come out in the first 2 days of discussion that, from my perspective at least, I think are worth emphasizing up front, and then we're going to back up and try to look at some of the contextual issues. And what I'd like to do is read something out of the paper so I articulate it relatively well, and then I want to try to just color that in a little bit with what we heard on the first day and to some extent as well on this day. So what the paper suggests, that sort of this slide is reflective of, would be the following. Every research initiative designed to provide an evidentiary base for action on behalf of vulnerable children outside of family care should begin with a recognition of the core insight of human ecology, namely that all developmental influences and processes occur in context, as defined by biology, social institutions, culture, individual experience, and relationships. The contextual array is so powerful that when the question is, does X cause Y, the best scientific answer is almost always, it depends. Therefore, the task of researchers seeking to provide an evidentiary base for programs and policies to protect vulnerable children outside of family care is to have an appreciation for the range of settings in which such children live, and to represent those situations in terms of the accumulation of risk factors and developmental assets. So it's risks and assets that is a potential focus of the research agenda. The more a child's situation is mapped with regards to risks and assets, the more the answer to the causal question, does X cause Y, will move from a generic it depends to a more specified it depends upon A, B, and C. In more formal terms, the more the risks and opportunities are mapped, the more our understanding will account for variance and outcomes. So as I listened to the conversations on the first day and the second day, this is I think where we end up collectively. And I think to some extent in terms of we need a framework. We need a framework that takes into account reality, and we need to look at not just risk, although risks are important, but also assets that may exist inside a child or in a child's social ecology. Now, the second perhaps important thing to emphasize is that what research suggests is that it normally is not one risk factor that tilts outcome in a negative way. And there's research that has looked at, for example, in this country, 8 different kinds of risks that have to do with being with or without parents, that have to do with racism, that have to do with various other factors. And they found that not any one of those particular risk factors was predictive of negative outcome. And they looked at intellectual capacity, for example, and they measured, in part IQ, a capacity to learn. And they instead found that it was the accumulation of factors. So 1 or 2 of these so-called risks, most children could tolerate, and there wasn't, for example, a diminishment in capacity to learn, and they were able to sort of take hold of life later on. But when you got to 3 or 4, the likelihood of a negative outcome went up significantly. Now, again, I would say that if you take those 2 things together, that this not only becomes a research framework, but it also becomes an operational framework. And really the objective from an operational standpoint is to ameliorate risks, to identify those risks and try to address them. But it's also to maximize opportunities. It's also to look at assets, either inside a child or outside a child or both, and also address those. So we heard earlier today that, I'm in favor of resilience. Okay, mapping out assets is part of resilience and whatnot. But we also have to be very cognizant of real risks. With that in mind, what I'd like to do is back up a little bit and talk about some of what we heard primarily on the first day, which I found, again, some of the presentations. I found all the presentations very interesting. But there were several terms that were put out in terms of the impact of adversity on kids that I thought were quite important. One was the concept of signal and response. And it was talked about in the context of children growing up and the need to sort of be parts of relationships. And any of us that have been parents, and when your child is young and you look into her eyes or his eyes or whatever, and you watch the progression of just facial recognition, and at some point you become a real object, and you see that light that goes off in a young person's face when they actually recognize a familiar face. Or when a baby cries and she or he is fed. Or when a young child needs its diapers changed or the equivalent thereof. So it's signal response. And this, regardless of context, regardless of form, is a primary fundamental part of the human condition and what it means to be human, and also what it means to grow up strong or resilient in a way. And in the absence of that, we have problems. The other part of this that was spoken about was the absence of response, and that to me set off a lot of different examples that I've seen over the years that I think kind of color in what we're talking about here, make it a little less abstract. For example, in 1994, in the summer of 1994, in the aftermath of genocide in Rwanda, there was a large group of refugees that were in the northern part of Rwanda that were captured there with the Hutu military and civilians, and Operation Turquoise. The French got involved. You all might remember that. And finally, that logjam was eliminated, and there were close to 1 million people that poured into Goma. And Goma is lava rocks on this incredibly beautiful lake, Kia. And the people were hungry and they were starving and they hadn't gotten a lot to eat because the military sort of kept them captive and whatnot. And they flooded down by the tens of thousands, the hundreds of thousands, and they saw this beautiful lake and they started drinking out of the lake. And given that, the way that the lake works and how deep it is and whatnot, it's one of those places that doesn't go down and cleanse itself and come back up. And to make a long story short, people got cholera. And they came from an immunologically naive place where that wasn't a problem into this gorgeous paradise, so to speak. But they all got ill and they were dying by the thousands and the tens of thousands. Now, in the midst of this cholera epidemic, so the world was focusing on the health crisis, there was this protection crisis. And we had people that were attempting to save lives physically by taking children out of communities where people were dying and then putting them in orphanages. And one of the organizations that did that was Caritas, a Catholic organization with a history in the region, honestly, of taking kids out of their families at a young age, keeping them in orphanages, and then putting them back in families at the age of 8. And again, one would think that that's not solid practice, but it indeed is what was happening. So this is what they did. The babies went there, and they were lined up on these cots like loaves of bread. And they had their intermediate feeding, and they were being therapeutically fed, and their physical health was being addressed, and over 13% died. And I don't know if you've ever seen an infant die, but there's a moment where you realize the child is going to die before it's dead, and it checks out, and it gets this look on its face, and it's the opposite of what you see when you look at your own kids when they're babies. Now, sorry, if there was ever, those of us that sometimes work in these places, we have these moments that are difficult. This was one of those moments. But the point is, the funding was for food. The funding was for health. And the child got that, and she still died. And it has to do with the signal response. How often can you cry and not be fed? How often can you long to be held and not be held? And at some point you give up. So if there was ever an argument for the twining of health and well-being, that's an example of that twinement. But we fund things separately. If we move from emergency to poverty context, and we look at a great initiative, saving newborn lives. A lot of kids die in the first 28 days of life. There's 10 things you can do at the community level, and if you do those things, the outcomes within those 28 days, nearly 100% will live. And the initiative looked at the countries where the need was greatest, where neonatal mortality was the highest, and they've implemented this thing, and it is a tremendous program, and it's been, you know, the results are there, et cetera, et cetera. Now, again, this is wonderful, but where are the 5 things that we can do to deal with the well-being issue? Why aren't those 2 things twined? Where is saving newborn lives when it comes to emergencies? Why isn't it in emergencies? Again, it has, I think, to do with structures and silos and thinking separately at times where things can be integrated or twined together. If you look at the work that is happening in the child protection systems area, and if we go to Uganda, for example, or an equivalent country, we've learned in Uganda that 85% of the protection burden is borne at the community level. Okay, we're just talking with Gretchen in a northern part of that country. There's one government service provider for a huge population. So the day-to-day reality of protection happens at the community level, and that's not different than, say, the health systems. What is it, 65, 75% of what needs to happen to keep kids healthy and well actually has to happen at the community level and the household level. It's not as vertical as a maternal health system, for example. Why aren't we pursuing these things together? If we're going to roll out a community health systems initiative, where is the protection health systems initiative that's part of that? Now the third thing that was talked about on the first day was the need to protect from danger and threat. The need to protect from danger and threat. So if we move from babies to school-age children, for example, and we look at the prevalent studies of domestic violence in 5 African countries, we find that 50 to 55% of women in these households, and it didn't matter whether they were in a refugee camp, an IDP camp in northern Uganda, or in the context of Ethiopia, where we looked at kids in displaced person settlement compared to regular communities, to Liberia, etc., CAR, 50 to 55% of the households experience domestic violence on a regular basis. Now, go back to the learning chart that we all fear as we get older, because we don't come out too well on it. But go back to the executive, the executive thinking and whatnot. And really, at that point in time as well, gender definitions are often solidified at that point in time. And you're a girl or a boy growing up in a household where your mother's getting beaten up on a regular basis. And what does that tell you in terms of being a male or a female? And a normative experience. And again, you meet individual children in these contexts, and I can't forget the 13-year-old girl in northern Uganda who had a bad thing happen to her outside of her family. She was sexually abused, and it didn't register that was wrong because it had become normative. And that's just not okay. That's just not okay. Now, the thing about domestic violence is they don't go to UNICEF, they don't go to UNHCR if you're in an IDP camp, and they don't go to the government. So it doesn't become part of the record because it's domestic and it's private and hidden. But sisters know, and neighbors know, are we tailoring our methods and our surveys, et cetera, to the people who know, to the informal information system? is another challenge. Let's just go forward one last time so we make sure that we're looking at adolescents and youth. And again, so you live in resource-restricted countries and your family somehow is sacrificed and you're in high school, or even if you're lucky enough to be in college. And how many young women have to engage in transactional sex to get back and forth to the high school, to have teachers hit on them? And I've heard it in Liberia where there's actually family conversations with, maybe you should go ahead and do it because at least you'll get your fees paid for in your school books. Or young women in universities and the economic cost of that. Now we need to do better than that. So education is one thing, but is it safe education? So I think as we think forward about a research agenda, I think it's important to think about the realities that we're talking about and this response, the signal response, the absence of response, the need to protect from danger and threat, and this risk accumulation model, which I would argue should be the way that we frame research. And it also ought to be the way that we think about program interventions, and that those two things need to come together. And I think implementation science is a way of putting those things together. You learn through operational actions. And you don't separate necessarily thought and action that far, that you keep those things together. Okay, what I want to do now, let's see if I'm going the right direction. Yeah, okay. All right, so with that as kind of a core thought, what I want to do is just very quickly go through the background here. We've talked about numbers. We don't know the extent to which these numbers are accurate. It's hard to collect information, especially on children that are engaged in things that are illegal, whether that's child soldiering or whether that's trafficking, et cetera, et cetera. And I'll just say one word about the 1.4 billion people who live in income poverty. Now, one thing we haven't talked about is how are child rearing behaviors and patterns actually linked to economics. And I always joke, I have 3 wonderful sons, and the last one's in college, the other 2 are, in a career or getting their doctorate, and I adore my sons, and I'm glad to have invested in their education. Some I call it, I don't want them to come home. I don't want them to come home. I want them to move on and whatever. But if you grow up in Aceh, Indonesia, you've got to obey your parents, you have to be a good Muslim, and you have to earn a living, but then you have to come home and take care of your parents. So to some extent, how we think about expectations of childhood and child rearing is fit to the economies, if not other things, in countries. If we look at child rearing in the context of scarcity, again, imagine you're in Rwanda and you're 6 years old and you're watching the household's cattle, and that's their biggest asset. I mean, imagine turning your 401k over to your 5-year-old. Now, what do you expect that young person to do? And what happens when he, in this case, does something that threatens your livelihood? In that context, you want to make sure that young boy does what he's told when you're not present. And there's a way in which you may do child rearing that would be quite strict. Or in Rwanda, I saw a grandmother take a 3-year-old her granddaughter's hand and stick it in the fire and hold it there. And when I asked, what in the hell do you think you're doing? I didn't quite say it like that, but that's what I was thinking. And to paraphrase, she said, I have to make sure that when I'm gone, she doesn't play with fire because she could burn down our house. So again, people are busy earning things, and child rearing happens in an economic context. And so when we look at this number, despite, even if they're not trafficked, even, et cetera, we have some contextual understanding at minimum that we have to understand. Now, these are some things that the authors of the 5th paper put down. These are things that members of the group believe are empirically true. And I would say that there's quite a bit of evidence that suggests that much of this is true. I think if you put it in the risk accumulation kind of model, any of these things potentially could be questioned. But it would depend on, again, the risks, but also the the assets and the opportunities and the combination thereof. If we go back to the slide, I think that Alistair showed us about overall in the program evaluation, things got better, but there was lots of variance. The variance is accounted for by these different variables. So where these may be generally true, there could be cases where, in fact, they're not necessarily to the individual child true. Now, I'm going to just sort of focus on this slide for a minute, and then I'm going to put a few people on the spot and ask them to comment about this, because these are the worlds that some of you live in. So there's a comment here that child vulnerabilities are multidimensional, yet global programs are fragmented. So this is global. Child protection is a sector in its own right, but to protect children effectively, it must be closely linked with other sectors. And then there's opportunities to build on country efforts with the recent and rapidly spreading country focus on child protection systems development in various low and middle income countries. Susan, I knew it. Do you have any comments about this assumption? Do you all know who Susan is? Susan Bissell, UNICEF.
So these is one assumption, is that what you're saying?
I'm curious what you as head of Protected and UNICEF would say about
I guess I would agree. I would say the first is a work in progress and linked to the third, and I think they're absolutely true. I think what's missing for me, also in something earlier you said, if I can, is just I think it's not just semantics to think of these things also from a human rights perspective, and I just wanted to table that before we leave this room.
Great, thank you. Yeah. Mr. Bell, do you have any comments?
Not really, because I think I wrote some of those statements. They're not evidence-based.
Say it again?
They're not. Most of them are not. Well, they're factually true.
Yep.
So child vulnerabilities are indeed multidimensional. Global programs are fragmented, both within child protection and between the sectors, between child protection, health, education, social welfare, and so on. So a lot of those are factually true. I suppose the question that you're getting at here is partly about systems. Do we have the evidence about the value and the benefit that will come from a broader systems approach, as opposed to the current approach, which has been issue-based around silo-based? So, and I suppose the argument would be, in this as in many other areas, we don't yet have the evidence to demonstrate the importance of this approach. We believe it's the right way to go. And not fundamentally, I suppose, because we also believe that protection is needed for all children and not just for the most vulnerable. It needs to be in place for all children.
Okay, thanks. Okay, so if we look then specifically at the U.S. government, this was what we sort of came up with in group, the people that wrote the paper, that the U.S. government is spending a fair amount of money on these issues, but the programs are fragmented by legislation and by agency mandates, and that interventions targeting vulnerable children tend to focus on addressing the needs of children according to their vulnerability rather than building systems that effectively address all vulnerable children. So there's money that's targeted for HIV/AIDS, there may be money that's targeted for disabled children, there may be money that's targeted for orphans and vulnerable children, and other sort of risk categories, but that may make it difficult to work across vulnerabilities situationally and or produce systems. So I'm just curious, within the U.S. government, Gretchen, do you have any comments about, so Gretchen sits in the OVC HIV/AIDS arena.
Let me just say that it is much better than it has ever been, and I think a lot of that we owe to bringing people together under PL 10995. But also just, I think, in the many different programs that we work in, there is a recognition. I mean, I work in HIV and AIDS. But you don't fix the system for just children affected by HIV. And HIV is too interlinked with other problems. I mean, HIV doesn't necessarily become a problem beyond the physical and the social and all that, but it doesn't become, what can I say, it becomes more of a problem the more impoverished, the more isolated you are. And so all these things link together. And I think that we've really come in PEPFAR and USAID to the realization that strengthening the system to last, to cut across the vulnerabilities of children is incredibly important. It continues to be important to not forget the unique needs of particular groups, such as children who are living with HIV. That's without question. But I think over the past couple of years, that's really been a huge focus and is certainly part of Ambassador Boothby's vision for the PEPFAR program to leave a lasting legacy, both in health care, but in allied, we work on social welfare systems, so child protection, and our allied system is health, but for most of PEPFAR, it's health, and the allied system is social welfare, one of them. So yes, that's true, but it's becoming less and less true, and I think there's a lot of room to continue on that path in a much broader sense.
Great, thanks. Anne-Marie, do you have any comments on this subject from the perspective of the field? So Anne-Marie works in Nairobi, and is it a regional position? Yeah.
East Africa. Yeah. I mean, I think that what Gretchen said is correct, that they're true, but we're changing, especially bullet 4. We really want to expand the reach of USAID to cut across the silos to help all orphans and vulnerable children, not just those that are street children or in orphanages or institutions. But that does take effective, to pick up on what Susan said, effective advocacy for the child protection sector, both within the agency as well as to our external stakeholders who both regulate us and fund us.
Great. Thank you. Joan, can I pick on you for just a minute? So the last bullet here is that the U.S. government's foreign assistance programs does not have a singular bureaucratic home for vulnerable children or child protection. Now, you've been in the system in various incarnations, et cetera, et cetera. Does this matter? Sorry.
I think a home matters, but it doesn't have to be a place that runs everything. I think you can link things together, and I think that's what you're trying to do. I would only add to this last bullet that it's not just about U.S. government foreign assistance, because we're not the only player. Mm-hmm. There are other foreign assistance.
Sure.
And so in that conversation, I think it is time for us to think about the other foreign assistance and the other multilaterals that are also doing work in this space, and how do we cross those silos?
Okay. Okay, great, thank you. All right, we'll move on here. So I think in terms then of this particular statement, we know what we don't know. And again, I think what has really come out over the several days, and I guess what this group sort of concluded before this conversation, so there seems to be some triangulation here, is that at the country level, there really is a lack of basic formative data. And I think if you looked at, let's just say, low-income countries, probably the majority of those governments in those countries don't know how many children are living outside of family care, don't know how many institutions that may exist, and they lack this basic data. Now, there's been some conversation about, well, we have these existing surveys, and what we need to do is we need to, integrate, some questions in here. Now, part of the problem with that, if you talk to a Bureau of Statistics or a Minister of Statistics in a low-income or middle-income country, they will tell you we can't change this. This is a global thing, and we'd have to have consensus from all around the world. And so there's very little we can do within existing systems. And I think if you're in a particular agency that has its own system and you're struggling to get an indicator or two into child protection, that's a worthy cause, but semicolon, we're not going to get very far with existing surveys. So to some extent, there's been new sorts of initiatives that I think are making quite a bit of progress. And again, the UNICEF-CDC partnership has been mentioned. CDC and Columbia University, my program, are also working in these areas to actually get prevalence studies that focus only on child protection going. And to me, I'd have to say the most promising examples I've seen are where collaborators are working directly with the government ministries and the Bureau of Statistics to get the Bureau of Statistics to do these on their own. And in Indonesia, this is happening. And in Uganda, this is happening. And I've had the privilege of being involved a bit in both, and more recently in Uganda. And the level of commitment, the fellow who runs the ministry responsible for child protection in Uganda is saying, this is exactly what I need. Because when I go to the parliament to make my argument, I can't say how many of these kids there are, and I can't identify what programs are effective, and I can't argue for my piece of the budget, my piece of the pie. So this is, I think, these fundamental basic kinds of information are absolutely critical. And I'd argue that information management or data surveillance, depending on what language you like. I like surveillance. I think protection people mostly talk about information management. To me, that's library science. But this is part of a protection system. And if we think about where we're going to invest resources in terms of getting data, this basic data that we need, and developing capacity at the same time, we might look for opportunities at the country level before we start looking at the needs of people in New York. I'll pick on New York. Okay, we've talked a lot about the latter point. Sometimes, and I've been there too, sometimes practitioners, we can be allergic to research because it involves sometimes skills that if we're working in the program delivery area, we may not have the kinds of skills required to figure out what representative samples are and whatnot. And we hear words like descriptive epidemiology, and our skin starts to crawl and whatnot. But really, what it is, it's a method of talking to people in a structured way, in a sample plan that lets us say more with more reliable, what we're saying represents reality. It's closer to that. And they certainly do this in the health sector, and they certainly do this in the nutrition sector, and increasingly we're able to do this in the child protection sector. Okay, now this is an interesting, to me, slide. The group did not really have enough time to look into this in any sort of rigorous way. But we were curious about, if you looked at, for example, child health and survival, compared to its operational budget, what does it invest in research and development? Is there some formula, some way we can kind of come up with that? And we didn't have enough time to do that. We actually asked a colleague who used to work in DFID, and he didn't know the answer to that either. But Bob, since you were working on this piece, would you like to articulate the question for us?
I think you said it exactly. I mean, the impression that one has, and I'm coming from the outside, is that this is an under-resourced area. The R&D component of this problem just seems like it's under-resourced compared to, say, other problem areas, diseases, and things like that. Now, that's easy to say, but how do you prove that? You need to have numbers, I think, to make that statement. It's got to be empirically supported. So one way would simply to be able to figure out what proportion of the USG expenditures in this area are used for R&D, and that's an easy question to ask, but not so easy to answer. PL 10995 has done a heroic job of developing a database of where the funding is. That's where that $2.3 billion comes from. But looking at that database, it isn't easy to figure out how much of that, is involved in research and development. So there would be, it would take some fairly heavy lifting. The other important point to why to do this, instead of just answering the question that I think we know, and that would be if we want to make some kind of a recommendation for changes, we have to have a metric for how to measure it. So if we had a way of measuring how much we're investing in this area and then measure it over time, we could see if we are moving in the right direction.
Great, thank you. So the proposal here, or the question, assuming that we think evidence is important, what is the proper amount or percentage to invest in that? And that certainly is worth looking into. Now we're gonna get into squabbles, I think, especially because I think we all would anticipate some reductions in funding available given the economic situation in the world, and it's like programs versus research. I would suggest that we don't think about it like that. And if we stick to the notion of implementation science, that we do operations and learn through operations, then the bifurcation it doesn't exist. as greatly. And again, think of the need to know and the thing to and the need to do, and how closely together can we keep those things? How closely can we twine, doing and learning operationally? And again, I think implementation science provides an option of doing so. Okay. The other issue that came up, I think, when we were grappling with some of this stuff was, well, people throw around words like it's good practice, it's best practice, it's promising practice. But we went through an exercise, I guess, in August in New York with 30-some people from different countries and global, and there is no, in the child protection field, there is no common criteria for determining what is good practice, what is promising practice, et cetera. So here's an example of where that has been done in a different context. These may or may not be the right things to do, but ought we not speak the same language when we start using terms like good practice and promising practice, and what is the level of evidence that we need to support that? So agency A comes to USAID and says we have the best thing since sliced bread. And where's the evidence to support that, for example? And any of us that have been practitioners, I think sometimes have been in the very uncomfortable position of exaggerating the effectiveness. So I think that this criteria and the research together could be quite important as we think about a research framework. This is something I think that was said quite a bit today, so we don't necessarily have to repeat or have conversation about this, but the long-term effects of interventions are poorly documented. In terms of determining priorities, the challenges include how to determine if a project has the potential to advance knowledge and how to sustain effective interventions, and these challenges should become goals and priorities for funding. So in addition to the risk resilience, the risk accumulation model, coming up with the criteria so we actually speak the same language around good practice, et cetera, we need to have some rubric to set priorities. And these are some suggestions in this area. Now, we talked about this slide for, 10 minutes in the beginning, so I'm not sure there's a lot more that I want to say, but I would like to ask Valerie, when you think about funding research and whatnot out of NIH, how do you think about doing that? Valerie does supports some really interesting research.
Well, first and foremost, I think about whether or not the research that's being proposed is in line with the mission of both our institute and then the branch from which my work emanates. So there has to be that kind of alignment, because at the end of the day, we are responsible for reporting on whether or not we've been good stewards of federal funds and whether or not we're accomplishing the NIH mission writ large, that we're helping to address compelling public health issues. So that's first. But I also think about, I have kind of a background that is somewhat of an eclectic background of research and policy and practice. So I often think about work that will help to understand, maybe more aligned to your second bullet there, help to understand the risk and the protective factors, especially the developmental assets. A good deal of my work has to do with underrepresented children, children who are particularly vulnerable, and oftentimes we use much more of a deficit framework for looking at these children. My personal and professional leaning is toward focusing on those developmental assets and looking at, from a strengths-based perspective, how we're able to ameliorate the effects of poverty, of any number of other kinds of risks. So when I'm consulting with a researcher on a topic, yes, I want to hear if it's aligned with the mission. Yes, I want to hear that it's good science. Yes, I want to hear that it's innovative and novel, that it's addressing something where there's a gap in the literature or where there's a gap in the research. In this climate of diminishing funds, we're not likely to fund many more of the same kinds of things that we've already done. But for me, as a person who's the steward over these funds, I want to see that there's some focus on the developmental assets, that we can look at how these problems can be ameliorated and have a good sense of what some of the mediating and moderating variables may be, so that the next phase of this work might be moving more toward addressing some of these problems from a solution standpoint.
Great. Thanks very much. John or Charlie, do you have any comments on a particular perspective on research frameworks? Charlie? Okay, great. John? Okay, thanks. All right, let's move on then. Do I point it here? There we go, okay. Again, and then looking for connections between research, practice, and policy. I think, again, an implication of the ecological perspective is that the relationship between policy and research is not unidirectional. Good theory and research can generate hypotheses, which are translated into settings where developmental processes and children's outcomes can be observed. And again, I think in terms of setting priorities, we need to make sure that the research is informing practice and policy. And we're going to talk a little bit about that in a minute. Okay, the other thing that if we go back again to, there's many presentations or many comments that we could go back to, but I guess visually back to what Alistair shared with us earlier today, and we look in the, was it the upper right quadrant, and there weren't a lot of longitudinal kinds of studies. And I think I underscore this because at least from what I understand and whatnot, much of the stuff that we understand about risk and resilience, much of what we understand about risk accumulation and positive developmental assets and what protects kids and social ecologies is been derived through longitudinal research. For the reasons that I think, again, Alistair's presentation or his group's presentation pointed out, is that a lot of the short-term stuff that we do isn't engaged long enough. And again, I think it also underscores, perhaps, at least in my mind, the difference between program evaluation. So we come in, if you look at the USAID results framework, for example, and you look at the various intermediate results, and let's just say there's 4 things you're trying to accomplish, you can go in and evaluate whether or not you accomplish those things, semicolon, that's a fraction of what happened. So to some extent, you have to wait till children are out of programs, and you have to look at what's happening then and there, and we have to look at, I guess from a program design standpoint, unintended consequences, which in some cases when it's been done, about 80% of what happens is either unintended or didn't necessarily happen through programs. So I would argue in favor of outcome research as a part of this, not to replace totally program evaluation, but if you really want to get your heads around what is happening to kids and what is your contribution towards accelerating, let's just say, good things, we need to look at outcome research, not only program evaluation. Okay. Joan.
What do you mean outcomes research and
I think that much of the money spent on learning takes place through an agency has done a program and they want the program evaluated, or the donor wants it evaluated, so they hire someone to come in and look at what the program did. And again, so there's 4, let's just make this up, there's 4 objectives to the program. The evaluators go in and see whether those objectives were accomplished, and then you say the program was this or that. Versus what happened to the kids who may have been in this program or were in this program, but you evaluate the outcomes of kids, but not necessarily through the lens of the program. And I think again, I think Alistair's presentation with those trajectories, individual trajectories versus the curve, were quite helpful. If you really want to understand kind of how kids get through adversity and whatnot, you've got to map out the risk. You've got to map out the developmental assets, and you have to kind of look at them over time. Because the variance, what accounts for this variance is the interaction between biology, between family, between social, between cultural, between context, and whatnot. And longitudinal work and research versus program evaluation, I think, are the best ways to get to that. Would you agree with that?
Yeah, I would.
Please.
I would. In fact, we were talking at our table earlier today about the intersection of research and evaluation, and to what extent might we have data sharing, opportunities to share data, and almost have this kind of a handoff where as program evaluations, as you get to a point where you've got these levels of evaluation and the information requirements extend beyond what your organization is planning to evaluate, that you could hand off some of those outcome types of questions or process types of questions to, let's say, an agency or an organization for whom that might be their mission, and then they could fund the research, they could fund those outcome studies and feed that back to the organization.
Yeah, that's great. We had an interesting conversation. A colleague from ORR in one of our discussions sort of said, well, we're talking a lot about various biases and stuff, but what about the researcher's bias in some ways? So there can be institutional biases. Any of us that have done evaluations for, let's just say, a large organization that involves several $100 million and the outcome, the evaluation isn't terribly positive, and then you enter in the conversation around the politics of the finding, and by the time you see the thing published, it doesn't necessarily resemble reality because political processes and whatnot. So agency bias is part of this, but also what about researcher bias? What about if you're asked to evaluate a gender program and you are a gender advocate? Ought you do this? I mean, I thought that was actually kind of an interesting question. And so one of the things, again, that's possible is to just think through some of these issues. In the medical profession, there's quite a bit of ethics and procedures and law around if you work for a tobacco company, maybe you ought not do research on tobacco. Or they've seen how that relationship, if you get funding from a tobacco company, how your research turns out versus people that don't get money from that. And I think we haven't even begun that conversation necessarily within this particular sector. Okay, Florence, I'm going to ask you. You say that you're funding resilience research in a couple of countries. What are you doing? How do you look at this? I'm an equal pick-on person.
I wish I hadn't mentioned it.
Sorry.
What are we doing? Okay. We have an international steering committee, which is a very nice term for having 4 resilience experts from around the world to advise us. So we took a learning question. What are we learning from children, families, communities about what protects them from abuse and exploitation in the context in which they live? So we have the research findings from a small area of Mercato in Adas and 2 areas in Bulgaria, including children institutions, but not only children institutions. And the 3rd site is about to begin. Now, while the 3rd site begins in Nepal, Ethiopia and Bulgaria are ready to take the findings, and the group is looking at programmatic implications. And then we hope to build in some of those programmatic implications within projects that we can then fund and monitor and evaluate to see if it has any impact on outcomes. Does that make sense?
Makes
I think that's what we're doing.
Great.
All right?
Congratulations. It sounds wonderful. All right, let's quickly move on. There's a number of ethical considerations, and I think in the interest of time, we'll just sort of walk through this. Many of these things have been discussed. I guess to some extent on this particular slide, there's an extraction model which academics are particularly guilty of, and then there's a capacity building model which is perhaps preferred in this area. And again, criteria that research ought to benefit, programs benefit beneficiaries. The authors of this paper thought that was quite important. This has been covered. I think we talked about, for example, orphan and how that term can be quite pejorative in certain cultures. There's certain languages, I mean, just to emphasize this, that when you use the pronoun in English, it would be I am. When you say that in some of these languages, what it really means is I, the person from this family, or I, the person from this community. Or if you look at some of the uses of, Joe Smith versus Maria Gonzalez Martinez. I mean, it's bespeaking relationships as we choose the way that we call ourselves. So if you're from one of these places that the personal pronoun means I, the person from the family, I, the person from the community, and someone calls you an orphan, it doesn't mean that you're just, it's not just your biological, but it's like no one in your household, no one in your community wants you. I mean, there's this, so we, just labels. We need to be cognizant of this. Who defines the research agenda? I think we've heard different perspectives in this meeting. One perspective seemed to be, what does Washington need? And there's another perspective, what does, hypothetically, Uganda need? And I think that that's an important thing to keep in mind. Now, if Uganda had better information and data, Washington would be better informed as well. So I have a bias here. I would focus on the country itself. Okay. I guess to some extent, there's these concerns about undertaking research, but there's really quite a strong ethical counter to that, which is, should we be doing programs in which there isn't evidence of efficacy? And how ethical is that? So to do research, to build up the evidentiary base, really is also an ethical calling that we ought not ignore, is the bottom line on that one. Okay, well, we got more ethics. Good Lord. Okay, there's lots of guidance in this area. I think one of the questions, and I don't know if I have a strong opinion, but again, if you're part of the academy, there's the IRB board, and anything we do has to go through that. And by and large, it's probably a good thing. It's a pain in the rear end on occasion, and they don't necessarily always understand if you're working globally and whatnot. But by and large, it's a good thing. There isn't the equivalent in this area. So if you're an operational agency, you can kind of do what you want to do, and no one's going to call you on the carpet. Ought there be some sort of ethical review? Now, again, if there was an earthquake in Haiti, again, you wouldn't necessarily want to go through that. So one would have to be flexible. But what are the ethics involved here, and is there any sort of standard procedures? And there's some things that we can build on, including NIH guidelines and various guidance books. All right. The last sort of content area then is that, again, this is something that's been discussed throughout. And I think one way to consider it, I don't know how many researchers in the room have ever done research and then got annoyed that no one paid any attention to it. And so I think that's one. I do the work and pay attention to me. That's one model of doing it. Or there's the other. You're an operational agency. You have a consultancy budget, and you want someone to come and do a piece of work for you on your terms of reference. And whatnot. So you hire a consultant, there's sort of demand, supply kinds of things. I would argue that at the country level, neither of those is a particularly good way to move forward. And as we think about a research agenda that would be wedded to an operational agenda, think about sort of it's kind of lousy language, but an integrated knowledge transfer model where key decision makers in government and civil society sit down with researchers, and there's a discussion about what is the next piece of evidence needed to understand how better to protect kids. Whether it's building systems, whether it's understanding program outcomes or whatnot, and you co-determine the thing. Decision makers have to wed themselves to using the results to change practice and policy, and researchers have to stay relevant. So it's sort of a co-determining model. And this would be something that I would suggest that we consider as we look towards developing a program between now and July. I think part of this then is engaging universities in the so-called Global South or in low and middle income countries. There's been some very interesting developments recently. Santi, who is sitting at the table, is co-director of the Center on Child Protection at the University of Indonesia, which was funded by USAID. And is doing some very interesting work with the governments around systems development, around looking at the centrality of child protection within the social protection, sustainable development, national priorities. Eddie, who's from Uganda, is looking in Uganda to set up the Center for the Study of the African Child, which would be, again, working with the government to help it develop some of the evidence that it needs to move things forward. Uganda also has an incredibly wonderful national child protection graduate training program. They have a course for practitioners, and they have a course for new graduate students, and it's been endorsed by the government. The government says this is the nation's child protection curriculum. So engaging researchers and training the next generation of child protection personnel in low and middle income countries was considered to be important as well. All right. What we've come up with is a very, very short list of recommendations, and in terms of a context. So we're suggesting as a preambular statement that the strategy to be developed as a result of the Evidence Summit should be the learning arm of an operational leadership initiative, that we want to make sure that the learning and the programs unfold together. We think there's more that can be done. We think twining health and child protection, the evidence clearly supports that you can't separate that. We've given examples of where the separation has led to death. We've given examples of where the separation has left kids at risk. Let's just do this, and then this is the last slide. So we have 4 very short recommendations here. Define an interagency research agenda as a first step towards defining a broader research agenda on child protection in low and middle income countries. So we see children outside of family care as being part of a larger concern. Ensure that defined priority research areas are adequately funded. The question of some sort of formula or percentage is at play here. Ought we do that? If so, what ought it be? Adhere to clear ethical guidelines for research and establish a long-term and focused effort to develop integrated knowledge transfer mechanisms in developing and middle-income countries, and promote partnerships between universities, researchers, policymakers, and civil society in those countries. So we think that actually the learning needs to be located where the protection needs to take place. So that was what Group 5, is that what we are, came up with? And let me ask, to begin the conversation, if anyone in Group 5 has any comments around this, and then if other people have comments towards recommendations, and we have about 15 or 20 minutes left. Is that right, Joe? So, Philip? Okay, great. Comments, criticisms, questions? Are you still awake? Yes, ma'am.
I just want to return to the point that was made in an earlier slide because, again, my background is mostly in government, so I always view what can the government do to create bigger problems and hopefully in one time can they solve them. But I think we shouldn't just move on and say having a home or having some sort of coordinated government-led strategy isn't part of this equation, because if we're going to do this research, we're hoping it's not only going to inform practice, but inform the development of good policies. And I think, at least in the experience that we've had in some of these same areas in U.S. policy and talking about it on a domestic context, it has been a beautiful blend of, the government trying to set outcome measures and different policy goals, and then the practitioners using that information to guide best practice, and a lot of that back and forth that we've spent all this time today. And I guess, I would just ask, when we look particularly at the work that we do abroad, I think there is something to be said when you establish an office of to combat global trafficking, and you do things like have a food security bureau and different things. I mean, maybe the very first step is saying this is a priority area. This is something that we think deserves a coordinated approach, that we would like to use what opportunities we have to advance. And so I think we have to not lose sight of that particular point.
So sorry, do you think there ought to be a bureaucratic home for children?
Well, I don't know that there ought to be, but I think that we need to figure out why bureaucratic homes are established.
Okay.
Why in so many different areas that are critically important is that a necessary first step? And I don't know that it necessarily leads to better policy, but I do find that it happens a lot. So in a year, I've just seen several new bureaus established and new bureaucratic homes, and we're talking about research. Is that a necessary and good step to advancing better policy? And if not, then maybe it's not just bad for this issue.
Okay, thank you very much. Gretchen?
But just to plug for in our final recommendations of moving to action is that whatever we invest in the collection of research, that we should put an equal amount of effort into developing those routine monitoring systems in country to keep children safe, because it's just such a resource problem at this point that we may be able to answer some very great questions with research, but we also need to pay attention to the very basics of the system.
Great. Thank you. Ms. Bissell.
Building on that, actually, and I'm going to take a tiny issue with an earlier comment you made, but I'm sure it was an accident. The mix in well, I won't speak for DHS, and I'm no expert on mix, but I do know that has, over a number of years, been an investment on the part of many for precisely what you said. And it is a statutory responsibility under the Convention for governments to monitor, and that's one of the general measures of the Convention on the Rights of the Child. So if we're talking about big investments in, let me separate research from monitoring and evaluation, but I think we need to be sure, picking up on your last point, that they are investments in government, including local government and so on. So I wouldn't have seen mix as extractive or just for New York.
No.
And I would say then the same principle.
Did I say that? I'm sorry.
Well, you might have then meant the CDC, UNICEF, the violence studies that are going on right now, and the beauty of those is that they're government owned.
Yeah.
And we wouldn't. That's one of the principles of the partnership, is that we're not working on it in any of those countries unless the government is saying this is important to us. And so we're supposed to be using the data that's generated out of these big investments in this research to create baselines.
Yeah.
And
would you be able to just describe briefly for example, what happened in Tanzania? It's the more recent one, yeah?
Right.
The government was very invested.
Oh no, and I mean, this is I'd say a success story in terms of government ownership of the entire process of this national prevalence study of violence against children. And there's some issues still being under discussion about ethical research and so on, so there's a lot of questions and things to fix. But, at the end of the study, the Ministry of Health took it, called an interministerial meeting, and said, okay, what are we going to do about this? I mean, we have a big problem. So it's also a piece of advocacy, but I think that's an aside. Final comment I wanted to make, maybe, Bill, picking up on something you said about our systems approaches and what's the evidence base for systems and so on. And I would agree with you. I think UNICEF got to its 2008 child protection strategy with a shift to more systems work, not by a whole bunch of research on is systems the way to go, but on seeing that what we were doing was neither cost effective nor, frankly, effective for children. So, and I think this links to your point that the JALICA, I think we can learn a lot from the JALICA initiative, the Joint Learning on HIV and AIDS, and one of the conclusions was exactly what you just said, which is that the systems and the things we put in place affect not just HIV-affected children, but other children who have, and picking up on your point, multiple vulnerabilities.
Great, thank you. Yes, ma'am.
Yeah, I would like to add to what Susan just said about mix, for instance, as an example of data collection efforts and rectify some of the information that were provided in this regard. Mix is not decided in New York by UNICEF. It's the government of certain countries who approach UNICEF and partners because they want to conduct a mix survey. So, and the involvement of the government is in different steps. So they decide if they want to do a survey or not. They decide what goes or what does not go in the survey, and they run the survey themselves. So we just provide technical assistance. Now the issue that we have is that sometimes, of course, there is a need to include and collect more data, but we need to collect this data through validated and tested tools and questionnaires and indicators. So the benefit of this type of fora is because we're going to have the possibility as researchers to do this work of validation that this needs to be done prior to the inclusion of new questionnaires, so new indicators in large-scale survey of this kind. And when governments approach us because they want to collect additional data on additional subjects, sometimes we are confronted to the fact that we do not have the tools previously tested and validated. So this is one thing that I wanted to say. And the second thing is, in the slide where you presented the mix and DHS, again, mix and DHS are household surveys. So we cannot expect from household survey to collect information on non-household population. It's a tautology. So we need to explore other ways of capturing children who are not living in households. So we cannot expect that mix and DHS capture these children because they are not developed to capture this population. And there are new initiatives, and the CDC and UNICEF surveys of violence against children are very important ones because they provide additional data on new areas. But the problems of the population remain because the UNICEF CDC, again, are household-based surveys, so we are not capturing children who live outside household and will be more likely to be exposed to violence, exploitation, and abuse. So there was a little bit of confusion, I felt, in the slide presenting the lack and the limitation of certain tools because this is not something that can be captured through household survey by definition.
Thank you. Yes.
I might just not be able to globalize like everybody else, but my specific interest is children in institutional care, and I feel like we're dealing with specific individual interest areas that we're then trying to do a cross-cutting approach in. And while I really think the cross-cutting approach has a lot of merit, I also worry that we're going to miss some of the detail related to our specific populations of children. So I feel like we need to look, as we're developing these research agendas, we need to go to the specific first and see what each of these silo areas needs, and then figure out how we can globalize them or how we can't. Because I feel like in some of the research, deinstitutionalization has not been focused on because there is no government home for it. It hasn't been broadly embraced by foundations. So there's not a lot of research out there in this area. So, it may be, it's the orphan in terms of where the research is. So I just caution everybody that I think we need to be very thorough about what's missing and what's needed before we go 20,000 feet high.
Thank you. Any final thoughts? Conclusions? Say it again. You have 10 minutes. Okay. Well, we can always finish early. Great. So, actually, I'm going to pick on Gillan for a second. Could you just come up here a second? Yeah, I think if there's any person who's been working on this thing day and night and whatnot, it's been our friend Gillan, who has done tremendous work behind the scenes and whatnot. Thank you. Would you like to thank you?
I'll leave the final parting words to Robert and Don Steinberg, but just as Neil thanks me, I mean, this is a dream come true for me. I sort of landed in this field by accident. I was working with the UN in Angola and working on the reintegration of former child soldiers. And while in Angola, I came across a paper by Neil Boothby. That was the beginning of my child protection training and commitment. So I was frustrated back then that there weren't really systems in place at the time in Angola for identifying these children who had been combatants or porters, and there was no social welfare workforce to speak of, and agencies didn't really have much in the way of guidelines. So I never thought back then, I guess it was 9 or 10 years ago, that I'd be here in a room with people who are 100% committed, and you guys are truly committed. I mean, we've had 60 people in 6 weeks write 5 papers with no money. I mean, it's impressive. So I feel like my late nights and early mornings were well worth it, and I'm just really moved. Thanks.
I'm going to make a comment to see what your reaction is. Where did Neil go? Did I lose him? And that is, I was sitting there. I thought that was a great session. Let's give Neil a big hand. And looking at those recommendations and thinking about the capacity that we need to build in country to do research, which we haven't had a lot of conversation about, but we've had some. It's been my experience that even when you do the research, people don't necessarily use it, and I think that's what we're here for. But I was thinking back on an experience I had teaching out of the country policy and getting people to see the data that they already had in the country. Mixed data, the regular reports from UNICEF that come out, the information that's in the CRC reports that the countries do and the outside groups comment on. There's a tremendous amount of facts, and even if they're not disaggregated to the local level, so they may mask things, there is a lot of information out there on children in country, and I'm not sure that we've been doing a very good job of helping people put that to use and put it into use in a way that's going to change policy and practice. And so that was my thought when I was sitting here, and I'm just curious about other things that people may have been thinking about sitting here in these final moments. Go ahead.
There was one question that Neil raised, which I thought was interesting and difficult, which is the question of asking questions that it's not obvious what the use is for, and giving them back to the community. And I think it's there's something that we struggle with a lot, because on the one hand, there's a sort of greediness about researchers who want to collect as much data as possible, get as many variables as possible, make findings as watertight as possible. And we've talked about, multifactorial causes here. So there's always more you can ask. You're looking at child protection, and then people say, well, what about the housing, and what about education, what about water, what about... So I find that very difficult, because I'm often in tension with my colleagues, actually, even in our center, because coming from a human rights perspective, I tend to be much more stingy with the questions I want to ask, and really want to be very goal-directed, and then they say, but that's very limited. So I just wonder if anybody has some good suggestions for how you navigate this complicated balance. And I realize there isn't one easy answer, but I think somebody mentioned earlier, there's always a risk that these questionnaires get longer and longer, which is also, I think, a kind of abuse of people's patience and time. But on the other hand, we're conscious that we want to have data which is impregnable, so that we can push, the powers that be to listen. So I just would love to hear another 2 minutes on that if people have the time.
Any thoughts on that? Reactions? I mean, to some degree, it's this push between evaluating a specific program, which I think Neil was trying to urge us to look at the broader context of how children are doing, and then consider the factors that lead into that. The problem is your funding streams don't work that way, and policymakers want to know specifically, did this affect this? Otherwise, I'm not going to invest in it. And I think that's the tension and the dilemma that we're faced with as we move to a child well-being strategy that might look at community indicators that are not program specific. So these are tensions. That is the reason I asked you that question, Neil. Other final comments? Otherwise, I'm going to probably turn this over to Robert. You've been a wonderful audience, and really heartening to know that there's people that are this dedicated to every day improving the lives of children, and I thank you. I was honored to be part of it.